Peripheral neuropathy involves changes to the nerves. Symptoms include numbness, tingling, or burning of hands or feet. These symptoms usually develop gradually and tend to be mild. However, they can worsen with each dose of chemotherapy. Prevention and management. Extreme temperature changes can make symptoms worse. Wear warm clothing in winter and protect hands from extreme cold. Use lukewarm water when washing dishes or bathing. Notify your healthcare team when the symptom develops, when it interferes with normal activities, or if you have unrelieved pain. Chemotherapy affects blood cells, specifically the white cells, red cells, and platelets. The white blood cells are responsible for preventing infection. The neutrophil, which is a type of white blood cell, functions as the most important infection fighter. Red blood cells carry oxygen and help to give you energy. Platelets function to clot your blood. With a low white count, infection may develop and your body's response may be a fever. If you have a temperature over 100.5 degrees Fahrenheit or shaking chills, call your healthcare team right away. Other signs of an infection include cough, sore throat, redness or swelling or sores on the skin, burning with urination, shaking chills, sweating, loose stools, or diarrhea. In order to help prevent infection, we suggest washing your hands frequently. This includes your family members and friends. Also, avoid close contact with people who have a cough or are obviously ill. If your red blood cells are low, you may experience severe fatigue or shortness of breath with little activity. You may also feel some dizziness, lightheadedness, or may look unusually pale. If these symptoms are limiting your usual activities, please call your healthcare team. Certain chemo drugs may affect your platelets. A low platelet count may put you at higher risk for bleeding. Signs of this include bruising easily, bleeding gums, frequent nosebleeds, or small red spots under the skin. If you have bleeding, for example a nosebleed, for over 30 minutes that won't stop, call your healthcare team. Some ways to prevent bleeding include using a soft bristled toothbrush and using caution with sharp objects. Discuss the use of over-the-counter medications with your provider. Some over-the-counter medications may cause your platelets to function inadequately, which may increase the risk of bleeding. Specifically, ask your healthcare team about the use of ibuprofen or aspirin if your platelets are low. As a result of a low blood count, your oncologist may choose to delay treatment, lower your next dose of chemo, or initiate a growth factor shot to stimulate your body to make more of its own cells. There are also other options, including medications or transfusions that may be appropriate.
I remember the chemo nurse told me when she gave me that first round of chemo that within the next treatment, which was 3 weeks later, would have lost my hair. And it was like 2 or 3 days before I had the next treatment, it fell out. And it just fell out in gobs. So I immediately went down and had my head shaved. I thought it was the easiest way to approach it, and I went from there.
Like right now I have my hair back from chemotherapy, and it doesn't come in quite the same way right away. It'll come in a little thicker, a little more curlier, maybe even a little bit darker.